my name is Dr. Karen Morgan. I'm a physical therapist, and I wanted to teach you how to enhance your breathing, especially after having been infected with COVID and having restriction of your breathing. A lot of people have been telling me that they feel like someone's sitting on their chest, or they just can't get that breath, and they're relying on inhalers or other kinds of medication. And I wanted to show you that actually there are certain things that we can do to the diaphragm muscle and the intercostals that are attached on our ribs, that with some soft tissue mobilization, that's going to actually enhance your breathing. These muscles actually help you with your breathing. The diaphragm, when it contracts, it helps expand the rib cage, which lets the lungs expand, and when it relaxes, then we have exhalation of air. And also the muscles in between your ribs, those also have a role in expanding the rib cage and then also bringing it back in so that airflow is going back and forth through the lungs. After you've been through something traumatic like pneumonia or bronchitis, anything like that, and COVID, all of this isn't going to function as well. And so while medication is helpful, we also need to reestablish the mechanical precision of what's going on with our breathing mechanisms. So I'm going to show you some soft tissue mobilization techniques that will help you with that, and they're pretty effective, and just excited to share this with you. So thanks so much for tuning in. We're going to go ahead and gently palpate the edge of the rib cage, and so we have the diaphragm coming right in through here, and what we're going to do is we're just going to gently, so here's the rib cage, and gently go down and up under that and pull. And pull. And pull. And we're just going to do that all along the rib cage here. So we want that diaphragm to be able to have maximum excursion. And when we've had bronchitis or pneumonia or with anxiety, this is just going to freeze up, so we want to loosen that up. And honestly, really, with having COVID and having the experience of not being able to breathe, it's going to induce anxiety. So you want to be able to get in there and loosen this back up, because anxiety always prohibits our breathing ability. Okay, so that's one area, and you can just keep working in there as comfortable, and go all the way down around the edge of the rib cage, down, down, down. You can do this for a few minutes. You don't have to do this forever. How long have you been doing it, Kate?
A week and a half, I think.
When you're doing a session of it, how long do you do?
Just a few minutes.
Minutes, okay. But you've been doing it for about a week, and she's been able to get out and walk, and what else would you say?
I've been able to walk up hills without feeling like I'm going to completely run out of breath.
Excellent, excellent. So now what I'm doing is I'm going to the backside, and I'm just helping those, you can feel the tightness there.
Mm-hmm.
So we want to get in there and just rotating there. So you can do that on the other side.
Those ones are the harder ones for me to reach by myself.
Yeah. So she was saying it's harder for her to reach back here, as you can imagine. And after I'm done with her, I'm going to show you how to do that on yourself. So right in through here, as we get on the rib cage, we've got muscles in between those ribs called the intercostals, and we just want to go in and loosen that up. And you can just see it's more of a kind of just a gentle rubbing, hopefully not too uncomfortable. Just go up and down and up and down. All right, so that's me doing it on her, but for me to show you doing it yourself. So you can do, you're kind of grabbing and just kind of working, got the flat of my palm, pulling, can even use the heel of my hand, doing that all the way through the backside. And then just feeling where my ribs are, going in between the ribs and loosening up the muscles. going into the, underneath the ribcage to get to that diaphragm, and just trying to pull that down a little bit, kind of massaging underneath and underneath. All right, and that is it. Thank you so much.